Hi, I'm Roger Teeter. My wife and I started Teeter Inversion products in 1981. We've been doing this exclusively as a family business for 28 years now. We export to 37 countries. We've got over 1 million people using our home use equipment. During that time, we've accumulated hundreds of testimonies, some of them dramatic. So we weren't surprised when Newcastle University came out with a medical study that was a small sampling, but a very well-organized sample. It involved only individuals with ruptured third lumbar disc with extruded nucleus pustulosus and the ages of 20 to 40. They divided it into two groups. Now this is England, so there's a waiting period for surgery of 2 to 3 months. There was a control group that got the traditional physical therapy, and then the Teeter Inversion group. When it came time for surgery, the control group, of that group, 78% still needed surgery. With the Teeter group, only 23%, a 70% reduction in the need for surgery. Professor Mendelsohn, that conducted the study, said that that would result in an 80 million pound savings. Now, and I'm going to pause at this point and go to an animation of a medical study by Dr. Nackimson. You might remember him from your school days because he did a lot of studies that are in the school books. And this one wouldn't be repeated because it involves a surgically implanted pressure sensor in the third lumbar disc. Let's watch this video and then we'll come back and talk some more. A number of volunteers permitted a pressure sensor to be surgically implanted inside the third lumbar disc. The bright light you see is the location of that pressure sensor. The pressure inside the disc in the standing position was set at a baseline of 100% and all other body positions compared to it. You see that 100% reading in the upper right-hand corner. Everyone knows that when you bend over, the loads in your back go up. There you see it, 200%. But did you know that sitting is actually harder on your back than standing? 150% seated in good posture. That's the way most of us work at a computer, 250%. But this is the shock. When you go to bed, the pressure in your back does not go to zero. You take 25% of standing body pressure to bed with you. That's because the last 25% is not caused by gravity. It's caused by the construction of the spine. Hundreds of ligaments and 140 muscles in 4 layers. These ligaments and muscles stabilize the spine, but they also hold it in compression like a lot of rubber bands. The only way to bring the disc pressure to at or near zero is to pull enough traction to overcome those rubber bands. This study indicated that was a really big number, approximately 60% of your body weight. That study, I think, is the secret to why traction why you need high forces in traction. You've got to pull a force equal to 60% of your body weight to decompress a joint. The ligaments and muscles that stabilize a joint are extremely strong. And you've got to open that joint up if it's going to be self-aligning. For example, let's just take this as a joint. Again, encased in hundreds of ligaments and muscles. You bump that joint out of alignment. Overuse, misuse. It's actually held in misalignment by the ligaments and muscles that stabilize it. But if you can just get that joint to open up, to decompress, and if you move around, some gentle stretching, it will work to realign itself. But to get that joint to decompress, as we saw with the Nackimson study, you have to pull traction with about 60% of your body weight. Of course, as a clinician, you can decompress that partly and then make a very easy adjustment to give the correction that you're looking for. Start out at 20 degrees, even 15, and bring your patient along slowly to a level that they're comfortable with, shooting for 60 degrees to full inversion. You know, this depends on, again, the symptoms and and what you're comfortable with. This is the kind of force that will really make a difference. In 60-degree inversion or even full inversion, your body will lengthen, or the patient's body will lengthen 1 to 2 inches, joints opening up, and also there's a natural posture correction. The head, the thoracic box, the pelvic box, and the legs are all individual components of the body, and they all line up with gravity individually, actually producing that perfect S-curve. And when traction's applied with that body in perfect posture, the natural realignment is, of course, the most beneficial. So the point is, try it first on yourself. It will help your own practice. The benefits are substantial. Many clinicians have back problems from working over patients. It will help you with your back problems, it'll help you with your stress, and you will gain the confidence to use it on your patient. And that will make a difference. It can change lives. It changed my life. I spent 5 years with back pain problems, trying everything to fix it. Nothing really worked. Inversion fixed it. That's why my wife and I started this business. And I believe it will change your life, and it will give you the reputation of really caring for your patients and making a difference in their lives. Deal with the acute phase in your office and send them home after a few weeks with their own inversion table so they can maintain this with a passive activity and then bring them back on quarterly tune-ups. And you'll have done a service, you'll feel good about what you've done for them, and they'll be referring a lot of patients to you. I believe it'll change your life and the life of your patients. It changed mine. Give it a try.